about the healthcare sector, about healthcare workers, that we must do everything possible to support our frontline workers in hospitals, long-term care, the entire healthcare sector, to give them confidence that they can do their jobs with the lowest possible risk of their health and well-being. Frontline staff are critical to beating this virus. They are critical to beating this virus. I know all British Columbians support this goal, and I want to say this directly to doctors, to nurses, to care aides, to those who keep our hospitals clean and safe, to food support workers and everyone else on the front line. We are grateful. We are enormously grateful for all your efforts. We're making headway together against this threat, but we're far from prevailing. Everybody knows that. But we also know, Dr. Henry has said it, that you're performing miracles every day. I want to make it as clear as I can. We're going to spare no effort to ensure that you have the equipment you need to get the job done, including the equipment to keep you safe. We do have supplies in place, and we're identifying more. We will, of course, respect your collective agreements and do what it takes to provide the additional support, childcare, and extra accommodation to help you work effectively. We'll track down and punish anyone caught misappropriating, the better word is stealing, the supplies we need for your protection. But our healthcare system doesn't exist in a vacuum. It needs support from every part of society and every part of the economy, and those essential services must continue. They cannot be shut down. They're equally critical to beating this virus. Of course, we know, and we've said it, and everybody understands how important care aides and nurses and doctors are. But so are pilots flying test kits to labs, early education workers caring for our health workers' kids, grocery workers making sure we're all fed, and longshoremen moving critical supplies across the dock. We are grateful for your work, too. It must continue under safe conditions, and we're taking additional steps to clarify the conditions under which important work can continue, both in healthcare and the wider economy. We'll have more to say on this shortly, but we'll be calling on employers, unions, and WorkSafe to develop the protocols under the supervision of Dr. Henry to give those working in the economy the confidence they are doing so safely. Of course, in addition to this, and Dr. Henry has made it clear with respect to restaurants, and I've had occasion to talk to a number of mayors, including the Mayor of Vancouver today, clarity about restaurants and the fact that they can only operate on their takeout basis. And I want to say this, there's lots of discussion about all of the group of people that may not be following Dr. Henry's orders. It's our expectation that we all do so. It's what we owe to one another, and we must continue to do that. I want to say a couple of extra things. Yesterday, we convened Isabel McKenzie, the seniors advocate, staff of the Ministry of Health, and MLAs from all parties, including Shirley Bond and John Yap, who are Liberal members, including Ronna Ray Leonard and Janet Rutledge, who are NDP members, and Sonia Furstenau, the Green Party House Leader, to work together to build on the groundswell of community goodwill that is out there to support seniors. They've come back and reported with recommendations that working and using in alliance with Better at Home and the United Way to make to support seniors who are currently dealing with the consequences of social isolation necessary to protect their health. We'll have more to say about this on Monday, but I want to thank all the members of that committee and the actions that they have recommended are being put into motion. Finally, I just want to say we are all in this together, and today we're going to find more ways to be all in the fight, and tomorrow we're going to find more, and we need everyone to join us. We've said it before, but we need to say it again and again and again, not just in settings like this, but to one another, that we know, because Dr. Henry has laid it out, some of the toughest measures anyone has seen that are required for all of us to keep each other safe. Some of it is simple, soap and sleeve and social distance and self-isolate and stay home when you're sick and support seniors and elders and those who are vulnerable. But starting now, there's no longer any room for almost or pretty good or nearly enough. Starting now, our individual fight, our collective fight must be 100% all of the time and 100% of the effort and 100% right. I know it's a lot to ask of a lot of people. I know people don't get the information all at the same time, but we need to give our healthcare workers, our healthcare professionals, Dr. Henry, a whole team of people around the province who are preparing to deal with the health consequences of this virus. We need to give them the flattened curve they need to provide the continued service and the continued care that will help everyone in the province. Right now and every moment from here on, going all in on COVID-19 will save lives and our own lives and those of the ones we love. It's just that simple. Nous annonçons 77 nouveaux cas de COVID-19 aujourd'hui, pour un total de 348 cas en Colombie-Britannique. Parmi les nouveaux cas, un réside au Dufferin Care Center, un établissement de soins de longue durée à Coquitlam. Les équipes de santé publique et de contrôle des infections à la régie de santé de Fraser sont sur place. Chaque régie de santé en Colombie-Britannique compte maintenant des patients atteints de COVID-19. 200 sont dans la régie de santé de Vancouver Coastal, 95 à Fraser, 30 sur l'île de Vancouver, 19 à l'intérieur et 4 au nord. De plus, sur le total des cas de COVID-19, 22 personnes sont actuellement hospitalisées, 10 sont en soins intensifs et les autres patients sont à domicile isolé. We're ready to take your questions.
Thank you, Minister Dix.